critical when it comes to infection prevention and control. Obviously, there are quite a number of disinfectants that are recommended when it comes to dealing with pathogens. The number of aspects from antimicrobial efficacy to the safety, the environmental impact, and also when it comes to compatibility with metals. However, key to note is the best components over others, the phenols, the peroxides, the alcohols, because someone might want to be indicating use of alcohols and other infectants. And allow me that the Ebola virus is an enveloped single-stranded RNA virus that has a lipid envelope, which is highly susceptible to disruption by oxidizing agents. Also, the glycoprotein spikes, the GP1 and GP2, that help it to establish its entry into the host. They are highly susceptible to oxidation, and also the RNA genome. And the chlorine-based disinfectants, key to note the sodium hypochlorite, have both oxidizing and denaturation capacity. So they do both oxidation and denaturation processes that target the viral pathogens. And take note is that when you add the sodium hypochlorite into water, when it dissolves into water, it gets to form hypochlorous acid and the hypochlorite ions. And both of these are potent oxidizing agents. The hypochlorous acid disrupts the disulfide bonds in the Ebola GP1 and GP2, which leads to loss of the infectivity. Also, that acid reacts with the phospholipids and the cholesterol that are in the viral envelopes, which leads to the membrane rupture and what we call the viral inactivation. That's why bleach or the sodium hypochlorite or chlorine-based components are most preferred because of the hypochlorous acid and the hypochlorite ion. In fact, the hypochlorite ion, I didn't indicate, it helps in the RNA genome damage because they break down the ribose sugars, the nitrogenous bases that leads to the RNA fragmentation. And when that happens, obviously, the replication capacity of the virus goes low. So, team, key to emphasize, we must know that bleach is our best friend in this response because it's very critical to use. Team, let me emphasize, when we started many years ago, we used to, in the Monica Chesbro, used to emphasize the volume to volume, 1 to 10. And the reason was because the bleach used to be 5%. Things have changed. We have bleach for 3.5, 3.6, 60% when it comes to some sources like the sodium dichlorothiourate powders. Ensure that you follow through to make the desired concentration as per the formula that you see of available chlorine, available concentration out of desired concentration -1. Do not use 1 in 10 as we used to know previously. And key to notice that the application depends on the need. 0.5% is desired when it comes to disinfecting bodily fluids. Those heavily soiled, contaminated spaces, the floors, the gloved hands, and obviously 0.5% when it comes to hands, skin, and also disinfection of laundry. It's more preferred. Obviously, chlorine has its limitations, the corrosion of metals and tissues. So you need to ensure that you don't use a high concentration when it comes to the surface, the tissues or the body surfaces. I need to emphasize that chlorine decays, and the speed of decay depends on the storage conditions, the exposure to light, heat. Therefore, it's not recommended to use it over a single day. In fact, it can even be for 12 hours. And whenever possible, you can use starch iodine peppers that can be positioned as the activity of chlorine. Kindly move to the next slide. Team, allow me take a few moments, a few minutes to emphasize infection prevention and use of PPE. And obviously PPE, Joseph indicated, we are looking at the wearable equipment, those clothings to offer us a barrier between the biological agents to reduce on the risk. Obviously, Tony indicated the risk mitigation hierarchy. PPE is at the lowest level, but it's also very important. And core PPE is a core requirement. It's primary. And we must know that PPE must be correctly fitted. You must have adequate training in order to use properly and effective. And if this is not done, it can be an opportunity for exposure. Please note that it's not a one size fits that all of us we can put off the same size of the Tyvek, same size of the boots. So you need to ensure that you select the appropriate size of PPE to serve purpose. We key to note is that obviously when it comes to Ebola, we are now looking at high risk pathogen, and you must ensure that you adhere to heightened PPE requirements. And that's where we use the overalls. Kindly go to the next slide. The overalls that are key. Obviously, the gowns, I need to indicate that gowns can be done on, but I need to emphasize the overalls. Key to note, one, you have to ensure that you remove all personal items, the jewelry, the watches, the cell phones, the pens. You are not expected to enter the ETU or the hot zones where to collect samples from the patients when you are putting on all this. That is something very important. And then you have to put on the suit, the scrub suit, and rubber boots. Why rubber? The slip resistant, and this must be put on in the room. Then you have to move to here at the entrance of the isolation unit, and by visual inspection, you have to ensure that all sizes of PPE that you are to put on are correct. Make sure that don't put on PPE that will keep on trailing on the floors of the isolation units, and also the quality has to be appropriate. Then key to note is that you have to undertake a procedure of putting on the PPE, and this must be done under the guidance of supervision of a trained observer. And Joseph indicated the BADES system. Then after that, you have to perform hand hygiene. Let's not forget the 12 steps of hand washing, from applying of soap, wetting the being palm to palm, you know those things, the right palm over the left dorsum, intercalating the fingers, those different procedures, palm to palm, the fingers back to the backs of the fingers to opposite palms. You need to ensure that you clean up your finger, you perform hand hygiene appropriately. Then there you have to put on your gloves. Then you start on putting the gloves, obviously the inner gloves, and then you start on the procedure of putting on your coverall. And then after that, you move to the to ensure that the thumb or the middle finger, if there are some coveralls that have that provision, if it's not available, please put in a hole in the overall sleeve or the loop to ensure that it's affixed very firmly. Then thereafter, you put on the face mask, then the shield, the face mask, then the shield, and then you will have now to put on the head and neck covering. That is also very key as per the procedure team that is being indicated, and obviously the surgical bonnets covering the neck and the sides of the head have to perfectly fit, just in case you are putting on a head covering or not the entire hood. Then thereafter, you put on the waterproof apron. If not available, you can use a heavy duty one, which can be reusable, but this must be decontaminated appropriately. Then thereafter, you put on the second pair of gloves, preferably the surgical gloves. Why surgical? Because they're a little bit long. They have long cuffs, and ensure that the gloves are over a cuff. And then obviously you have to check in a mirror whether whatever you've done is appropriate, and you have to check with the day and the name. It's good for it to be written including each patient and time. Kindly move the next slide. These guidelines of donning are available. Obviously, there are wrong practices of, donning that are inappropriate. You realize that the individuals in there, they had improperly adhered to the PPE, to the code. You realize that the neck is visible. They didn't have a head and neck covering, no surgical net and head. So some of those inappropriate measures shouldn't be done to ensure that you prevent infection, for infection prevention and control. Kindly move to the slide. Obviously, now we move to the most important part, things stories, where our health workers normally get infected from. That is the doffing or the taking off of personal protective equipment. A team you need to ensure is remove the PPE under guidance and supervision of a trained personnel, a colleague, to ensure that the infectious waste containers are also available in the doffing area for a safe disposal. And also separate containers should be available for reusable items. So you need to ensure an individual is available. You also have containers for disposal, and also to ensure that there is proper segregation when it comes to those items that you have to reuse. You have to begin by entering into the contamination area by walking through a chlorine tray. Then you perform hand hygiene, the one that we went through clearly, the hand hygiene steps, and then using 0.5% chlorine, and then you remove the apron. It's very important to emphasize that you have to lean forward, taking care to avoid contamination of your hands as you are removing the apron. And then you expected to perform a hand washing. And maybe something very key to note is that when removing the disposable apron, you will have to tear it off at the neck and roll it down without touching the front area. You roll it inside out, and then you unite the back and then roll the apron forward. Please ensure that you do not your hands are not affected, and then you perform hand hygiene. And then the next case is for you to remove the head and neck covering, obviously taking care to avoid contamination of your face. And this requires by you starting the bottom of the hood in the back and rolling from the back front, from inside to the outside, and disposing it off very safely. And then you're supposed to perform hand hygiene. Then you move to the removing of the coverall. That is very, 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 very critical. And ideally, this should be done in front of a mirror. And you have to ensure that you tilt the back to reach the zipper, and then you unzip completely without touching any skin or scrub, and then you start removing the entire coverall from the top to the bottom after freeing the shoulders and removing the outer gloves. All those are very, very key aspects to follow. And also ensure that I need to ensure that you pull the arms out of the sleeves with the inner gloves. Gloves roll over the cover from the waist down, and from inside the cover roll down to the top of the boots. And also something very key is that you use one boot to pull off the cover from the other boot. Obviously, these aspects are very beautiful if it's a physical training, and then you perform hand hygiene, you remove the goggles, you perform hand hygiene, you remove the mask, you perform hand hygiene, remove the inner gloves, then decontaminate the boots, and then you perform finally hand hygiene. Team doffing is a very important aspect. Kindly move the next slide. It's a very important aspect, and this is where normally things go berserk or go wrong from. Let's finalize with waste management. Waste management is very critical. Kindly move to the next slide. You realize that the 85% of the waste that we generate is non-hazardous. And if we know how to manage waste, it could reduce on the cost of waste management, but also on the possibility of exposure. We begin off with minimization. You realize that you need to minimize generation of waste. For example, the bio bottles that normally carry the samples can be reused. These are upon proper decontamination using 0.5% bleach with adequate contact time of 10 to 15 minutes. Key to note, the syringes, the needles, the surgical blades should never be reused or should not be reused. And the second aspect when it comes to waste management is waste segregation. One of the principles for waste management, one of the 5 principles known as duty of care principle, emphasizes that the person who generates waste has the responsibility of packing, storing, but something very key, of segregating waste. Waste should be segregated at the point of production into a black, yellow, and red bin. And obviously, most of the waste which is generated is highly infectious, and it goes into the red bin. The next key aspect is storage of waste at the sites. Key to note is that waste storage on the site requires us to ensure that you store waste. You transport it properly, and also you store waste in a storage that is not near food, limited access, easy to clean, well ventilated. Rodents, insects, birds, dogs should not come near that waste. So it has to be properly locked. The area has to be locked. And also key to note is the transportation of this waste, whereby the vehicles that carry this waste must have a consignment note. It should be used, the vehicle shouldn't be used for any other purpose, and it should be free from any, the container should, the car should be fully enclosed, or the vehicle, to ensure that the waste doesn't keep on spilling on the roads as it's being transported. Obviously, the last key component is the waste disposal. Obviously, prior to disposal, we encourage autoclaving. And this autoclaving, we must have chemical and biological indicators. The biological indicator is the Geobacillus thermophilus. It's very key to indicate complete autoclaving, but also the type 1 chemical indicator, what we call the autoclave tape, is also very critical. And obviously, lastly, incineration as the final pathway of waste. Team, thank you so much for listening to me. I know our time is fast-tracked, but those were very key aspects to emphasize when it comes to infection prevention and control. We need you alive. Back to you, moderator.
Yes, thank you, Andrew, so much for emphasizing. I know we have lost some colleagues on this call, but this is the most critical bit of outbreak response, more so if you're working in the treatment units or the isolation units or the holding units. And Andrew makes it very clear on the practices. The hand washing practice is a very key thing. The 5 moments of hand washing are very key. If you do not understand these 5 steps, the key moments in hand washing and hand hygiene and hand washing becomes very hard for us to operate with you most times when we are doffing. It makes it clear about the chlorine preparation of 0.5 disinfectant and 0.05% for hand washing, or also use the alcohol hand rub at some point because of it may be creating some having some issues regarding it reacting with our skins and all that. But all in all, what Andrew mentions also is very key is waste management. There's a guideline I read by one of our colleagues here and mentions that the Ebola virus takes about 18 days minimum for its survival, the RNA in the to its best. We are going to have challenges in having ourselves contracting the disease. Sometimes even the PPE, we have found with people who carry waste putting on this PPE as luxury. So sometimes how we manage and dispose waste safely is very key for us. So as we finalize, I want us to go very fast to allow Rita and Amsosa to come and take us through very key items. One is on the referral. I've seen many questions regarding how samples should be referred. Number two, how to manage the results. So I had forgotten to introduce Andrew Tabor as a laboratory scientist with an infectious disease background. At the same time, he's one of the regional subject matter expert on biorisk management, as well as the head or the lab manager of the Central Emergency Response and Surveillance Lab. Andrew, thank you so much for your presentation. It was very good and candid. Let me allow Rita to come in at this point. Rita is a laboratory scientist also with an infectious disease background, a microbiologist, and has been very pivotal in policy guidelines and also actualizing the REST track system for tracking samples, as well as supporting the hub system and also the result management system that has been running in the country. Rita, you're most welcome. So these are our last sessions. So colleagues, don't drop off for now. Let's conclude this, but we shall have other sessions that will come in later next time. Thank you. Rita, over to you.
Thank you very much, moderator, and good evening to you all. I'm going to take us through the sample referral system and the result management system. Having heard about how we should collect samples to ensure that we are safe and protect the samples that we are collecting. So I'm going to talk about ensuring that the samples we have collected reach the reference labs. As you have heard, only 3 of them have been designated to test, and also ensuring that we are able to receive the results once they are ready. Next slide, please. For sample transportation for this EVD outbreak, we are going to stick to using our national hub system. And this is from the 100 designated labs and other identified isolation units where patients are being monitored. The contacts that have been listed are being monitored. So to pick from what Roger said, samples are only being collected from the designated isolation units or places that have been identified to monitor the contacts. So do not collect samples from any other place other than those that have been designated. For districts that do not have yet cases, ensure that all these samples have been collected at a health facility in a place that has been provided or identified by the health facility authorities to pick up these samples. And before you go to pick these samples, please reach out to the National Hub System Coordinator to ensure that we arrange transport prior to you picking the sample. It's better to alert the system when you're planning to collect a sample rather than collecting a sample and then you're stuck with it and we start looking for transport then. So ensure that you have contacted as you plan to go and pick the sample, so that as soon as you pick the sample, we are trying our level best to ensure that these samples are picked as soon as they are collected and delivered to the designated reference labs that have been highlighted. That's UVRI, the mobile lab in Entebbe, and then the Central Emergency Response and Surveillance Laboratory, which are now the only labs that are mandated to do EVD testing. Next slide, please. So ensuring that the samples reach their places correctly and on time, the EVD samples are being prioritized over the other samples. And that is ensuring that either vehicles are redirected or we get alternative drivers and vehicles to pick up these samples once they are collected. That's why it's essential for you to communicate before you collect the samples. And then reassign other riders to be able to boost the routine sample collection. So as you plan to pick the samples, please reach out to the National Hub System to ensure that we have arranged transport for you to transport and refer the samples to the designated reference labs. And as we are doing this, as I don't want to go over what Mr. Nkodio hinted on and Mr. Andrew Teba, ensure we are following the principle of triple packaging to ensure that these samples reach the labs safely and securely. So we are following the principle of triple packaging for safe sample transportation. And however much we are prioritizing priority samples, this does not mean that we are going to neglect the routine sample referral system. Next slide, please. So the results are going to be relayed to you through the National Results Dispatch System, the RDS. We all know this from the COVID time. It's the same system that we are using to relay the results. So as the samples move from the facility to order designated isolation unit and then referred to the reference lab for testing, the results will be relayed to you through the RDS system. Next slide, please. And as we transport these samples, let's us make sure that samples are tracked, because as laboratorians, we account for every sample that has been collected. So ensure that these samples are tracked in the REST system. We've seen scenarios where people collect off samples and they are unable to provide any details or any information about the sample they collected. So make sure that you use the REST track system for collecting. We have these barcodes and scanners at all the designated hubs, and also ensure that you record these in case you're unable to access the REST track system. Have this recorded, the details of the sample that you have collected, and referred to the testing lab, because we must make sure that all the samples that we are collecting are accounted for. Next slide. Yes, the results are going to be relayed in the RDS. So for those that do not have the RDS accounts, RDS accounts are assigned to the DLFPs to be able to access results for their different districts, and then to the DHO also to be able to utilize this information for number one response, but then also for patient care. So the DLFPs, you're responsible for ensuring that the samples that have been collected from your districts, the patients and the requesting officers get back these results. So for the DLFPs that are on this call and do not have RDS accounts, we shall share details of how you reach out, providing your details, that is your name, your role, the district you're coming from, your email address and your phone contact, and then we shall give you access to the RDS to be able to access results for your district on time. So if you don't have an account, it's the same accounts that we were using during COVID-19. So ensure that you are able to access results through that system using just go to your browser and type in rds.cphluganda.org, and then it will bring you the login page where you'll put your username and then your password, just like we used to do for COVID-19, we've been doing for MPOX. So it's the same portal, you're using the same credentials to be able to access these results. Next slide, please. We're going to talk about logistics management, because to ensure that you collect the good quality samples and make sure that they reach the testing lab in good conditions, there are key things that you must have. Next slide, please. So for the DLFPs, this is mainly for the DLFPs or the hub coordinators that are playing leadership roles in their districts. On the next slide, we are going to look at the items that we need, the key items that we need. So you make sure that you quantify for this, especially for the districts that have been highlighted as high-risk districts and those of intermediate risk. Make sure that you have a list of the items quantified for your district, and through the DHO, send this to the NMS for supplies, and NMS will deliver directly to the district. And also for lab-specific items, you can also reach out to CPHL for assistance in case NMS has not yet delivered, but we expect NMS to deliver to the respective of items that you will need. So ensure that you take Please, the LFPs or hub coordinators, make sure that you have a stock of this from your districts, for your districts. The IPC items, that's the disinfectants, the soap, and then like we have seen, we need JIC, the supply of gloves, safety boxes for collecting and disposing of contaminated supplies and equipment, the waste bins, all red, then the blood collection tubes, the whole blood collection tubes, the swabs, and then the specimen packaging. We need a container, we need a cool box, we need the ice packs, the cotton labels. This can be printed out at the labs. And as you're labeling, this should only, when we are labeling the samples, as you have seen, we don't label with the disease agent. We should follow the labeling as we've been taken through by Rogers. And then the case investigation forms. Please make sure you have the right case investigation forms, because this, if you don't have the right case investigation forms, still reach out to CPHL and then we shall have this provided to you, because if you don't have the right form and the form is haphazardly filled, there will be issues with accessing results through RDS, because the variables in RDS were created to fit in exactly what is on the form and to allow that we send results to the right places and on time. Next slide. Thank you. I think we have come to the end of our presentations, and thank you all.
Thank you, Rita. Thank you, Rita, and thank you, colleagues. Before you drop off, I just want to thank Rita for doing that quick presentation, so insightful on the sample transportation. We may not go into the questions, but we have been answering some of them, and she has made it very clear on how samples should leave, notify your district, and then see how the samples really move on. She has mentioned about the result dispatch system. Please, let's ensure that we have the access system. We have the rights to access the system, and let's look out on seeing how we can get the logistics through NMS and CPHL or NHLDS. She has provided us with a toolkit that is summary of what you need regarding the logistics for the EVD or Marburg outbreak. Now, at this point in time, I want you to allow me, colleagues, before you drop off, this has been done great. We hit over 500 people, and I want to thank you who have remained on the call up to this time. But I want to give this chance to the Umlta team. That is Gad Mbera, who has been the lead of CPDs through, or any Umlta colleague who is on this call. We want to really appreciate you for this cordial relationship with the Minister of Health to ensure that we have such a number. It has never happened ever since we are doing the infectious disease capacity building. So Gad Mbera, we give you thanks. I want to thank you. But let me give you opportunity to say something and then adjourn this meeting. Thank you. Gad, are you on the call? Yes, please. Thank you all. We shall share the presentations and we'll meet again. Thank you all.
Thank you. Bye-bye. Look out for the online test, post-test. It will be coming through shortly. Thank you.